I'm Yasmin. I'll be your student nurse today. I'm here to administer your antibiotic to prevent infection. But first, can you state your name and date of birth?
Kajang, 524, blah, blah, blah.
Good. So before coming into the patient's room, we want to make sure that our drug is labeled with the patient's name, drug, dose, time it was drawn up, the time we will be giving it, and making sure that the expiration date is good. Today we'll be giving ceftriaxone 2,000 milligrams over 20 milliliters. This can be pushed at a rate of 1 to 4 minutes. I will be doing it over 2 minutes. So we will do 10 mLs per minute or 5 mLs per 30 seconds, or breaking it down further to 2.5 every 15 seconds. So again, before coming into the patient's room, we have our flushes already primed. We've checked for allergies and compatibility. Okay, so coming in here, we've checked, making sure that the bag is the one ordered by the doctor, making sure that our chamber is half full, tracing the tubing to our pump, making sure it is at the correct prescribed rate, coming down, making sure there's no dependent loops, making sure that it is unclamped, tracing it, the tubing all the way to the port closest to the IV site, unclamping our clamp down here, and because it is continuous, we just have to alcohol the port for 15 seconds and then give our drug, or medication I should say. We're going to wipe vigorously for 15 seconds. Okay. Fix my glove quick. So again, we're going to give ceftriaxone. I'm going to be giving it 5 mLs over 30 seconds. Using the pinch release method. So as we pinch, we'll be giving the medication, and we're pinching above the port. So here we go, giving 5 milliliters. The IV site and our patient. How are you feeling?
I'm doing okay.
Okay, and the IV site looks good. Okay, pinching again. Administering the medication. Done. Go up here a second. Okay, giving another 5. Releasing it. And pinching one last time. We're gonna alcohol the port for 15 seconds. Okay. So now we're going to administer 2 milliliters of this flush, but this time we'll be doing it at the prescribed rate. So we'll be doing this over 2 minutes while pinching. We're almost done, okay?
Okay.
Okay, we'll be getting the last milliliter in the next minute. You're doing really good.
Thank you.
Okay, releasing it. And we can throw that away. And I dropped my alcohol pad. Luckily I brought extras and I have one right here. We're gonna clean the port for 15 seconds. Making sure we're doing this vigorously. All right. So now we are done with this, administering a medication through a continuous compatible infusion. So now we'll talk about what to do if it is incompatible. We have 2 options. Our first option would be to again come here, trace the tubing to the pump, pausing and delaying it, tracing it, making sure we are clamping, and we could pinch throughout the whole time. We would clean our port, give our 10 milliliters of the flush using the push pause technique, cleaning the port, giving our medication at the prescribed rate, cleaning our port once more, and then flushing the 10 milliliters again at the same rate we gave the medication, and then cleaning the port. And then again, just make sure you are restarting the pump at the prescribed rate and unclamping the tubing. Our second option would be to again pause and delay the pump, clamp our tubing, and we could disconnect this completely. After disconnecting it, we would apply a swab cap on here, label the tubing with a pink label indicating that it is now an intermittent tubing, and that it has to be replaced in 24 hours. And now this becomes a saline lock. However, we are going to clean the port, flush the port with the 10 milliliters, and then cleaning the port, giving our medication at the prescribed rate, cleaning our port, and then giving our last flush, the 10 milliliters at the same rate we gave the medication, cleaning the port, and then restarting the pump, unclamping this and restarting it at the prescribed rate. And then that covers what to do if it's incompatible. So now we will dispose of our equipment according to policy, perform hand hygiene, and document my findings.